Welcome to EAU Podcasts. In this episode, UROLUTS Chief Editor Dr. Magistro talks to Assistant Professor Tamalunas on LUTS medicines.
Dear friends, welcome to the DGU25. Here with me today, Professor Alexander Tamalunas, well-known expert when it comes to LUTS medication. Hello, Alexander. How are you?
Hi, Giuseppe. How are you? Nice to be here.
What's your first impression of DGU? Today is the first day.
Very interesting topics, very innovative people, very innovative projects, very talented guests at the EAU. So I'm very much looking forward to seeing more presentations in the next coming days.
Okay. LUTS has become one of the major topics here at the DGU, and Alexander is a well-known expert when it comes to LUTS medication, especially phytomedicine. So, Alexander, what's your general point of view when it comes to phytomedicine for the treatment of lower urinary tract symptoms?
Oh, that's a very interesting question, Giuseppe. One of the main topics, I think, when it comes to phytomedicines is that the EAU issued a statement in 2021 in their guidelines and recommended the use of phytomedicines for patients with mild to moderate LUTS, even though with the caveat that you should counsel the patients that symptom improvement may be limited. But if you look at the current available medication like alpha-1 blockers, PDE5 inhibitors, or 5-alpha reductase inhibitors, you see that they also come with limited efficacy and in some cases very severe and treatment limiting side effects, which is a positive thing for phytomedicines because apart from a couple of gastrointestinal side effects in the range of 3.8%, they don't really have major side effects. And even though their efficacy may be limited, patients tend to take that into account if you counsel them in the right way. And if you manage their expectations, they will be satisfied, especially with mild to moderate LUTS, if they take phytomedicines either as a monotherapy or also in combination, for example, with alpha-1 blockers. Phytomedicines seem to be efficacious. But of course, one of the major issues with phytomedicines is that the active ingredients are still up for debate. And as the 2021 guideline recommendation of EAU showed, they told us that hexane-extracted cerenorapins, so the saw palmetto extracted by hexane, is more efficacious because they pooled the analysis of two systematic reviews than any other extraction method of the saw palmetto. And if you look at Germany especially, we don't have hexane-extracted saw palmetto. So we need to look for a different alternative. And what we've been doing at our laboratory of experimental and translational urology and uro-oncology is that we looked in vitro at patients undergoing radical prostatectomy. We took from the periurethral tissue, we took prostate smooth muscle tissue and tried it in an organ bath with a substance that is made of more than 70% of natural beta-cytosterols, so phytosterols, because in my research I found that the smallest common denominator of all phytomedicines available in Europe are phytosterols in different concentrations, of course. So we use a phytosterolic extract, which has the highest concentration of phytosterols on the German market, and we found that it performed in vitro. So in ex vivo in vitro assays with real patient tissue, it performed similar to alpha-1 blockers in the same setting in a physiologic dosage. And so I think not only monotherapy, but also combination treatments of phytomedicines and alpha-1 blockers are very efficacious with a very positive safety profile. Because when you look at the combination of alpha-1 blockers and phytomedicines as compared to each agent as a monotherapy, the combination of alpha-1 blockers and phytomedicines has less side effects than the alpha-1 blocker monotherapy.
That's quite interesting. So we see that the extraction method, the preparation of the single compound is crucial to its efficacy. But another question would be, we know a lot about saw palmetto. Are there other medical products, compounds that maybe will be available soon, have some kind of potential to enter the clinical field?
So what I just said before, the smallest common denominator of phytomedicines are phytosterols. And we know that the maritime pine is efficacious in phytotherapy of LUTS and BPH. And there is one preparation on the German market which consists of more than 70% of beta-cytosterol, which is derived from the natural maritime pine bark, the Pinus pinaster. So if you compare it to the hexanic extract of saw palmetto, it is almost similarly efficacious. But of course, the data that has been shown in the EU guidelines of saw palmetto, of the hexanic extract of saw palmetto, is of much higher quality because it is from systematic reviews. But if you pool the data from the clinical studies concerning the beta-cytosterol, you will see that reduction in IPSS, reduction in voids per night, so nicturia, and also straining upon micturition is similarly improved with a phytosterolic extract, and may pose a very valuable alternative in the German market, which is one of the largest markets in Europe.
So, Alexander, this is quite interesting. So we can conclude that phytomedicine is not over. It's still to be considered in the field of LUTS treatment. So I'm looking forward to what is coming in the next years. Thank you very much for joining us, and I wish you still nice Congress here at the DGU25. Thank you very much.
Thank you for listening to this episode of EAU Podcasts. To keep up to date with the development of functional urology, visit our educational platform, UROLUTS. For more EAU podcasts, please go to your podcast app and subscribe to our EAU podcast channel for regular updates.